Hello everyone, welcome to For Nurses Preparation YouTube channel. I am Ritu. Let's start with today's question. Question number 1 is, which ethical principle promotes self-determination by the client? Your options are option A, autonomy, option B, non-malfeasance, option C, justice, or option D, that is fidelity. Answer is option number A, that is autonomy. Explanation of this question is option A, autonomy, means self-determination by the client. It means let the client and significant other to determine what they wish to do. Non-malfeasance means doing no harm. Justice means treat everyone equally. Fidelity means faithfulness. Question number 2 is, nurses obtains vital signs and determines level of comfort the patient. Which standard of practice is performed? Your options are A, assessment, B, diagnosis, C, planning, or D, implementation. Right answer is answer number A, that is assessment. Explanation of this question is, obtaining vital signs is objective data and determining level of comfort by asking the patient is subjective data. Obtaining subjective and objective data from patient is known as assessment in nursing process. Nursing process includes assessment, nursing diagnosis, planning, implementation, and evaluation. Next question is, which among the following signs or symptoms will be present in a patient with hypovolemia? Your options are A, increased heart rate, B, hypertension, C, bounding pulse, or D, urine output 30 ml per hour. Right option is option number A, that is increased heart rate. Explanation of this question is, in patient with hypovolemia, an increase in heart rate can be noted. Next question, the only endocrine gland which can store its hormone is, options are A, pituitary, B, pancreas, C, thyroid, or D, adrenal gland. Correct option is option number C, that is thyroid. Thyroid is the only endocrine gland which can store its hormonal secretion and can secrete it into the blood whenever the body is in need. Next question, question number 5 is, calcium balance in the body is regulated with the help of, your options are A, aldosterone, B, calcitonin, C, parathormone, or D, both option B or C, that is calcitonin or parathormone. Correct option is option number D, that is both B and C, calcitonin and parathormone. Explanation is, calcitonin produced by thyroid gland helps to mobilize calcium from blood to bone, and the parathormone produced by parathyroid gland helps to mobilize calcium from bone to blood. Both these hormones involved in calcium metabolism. Next question is, physician ordered oral as well as nasal suction to a client. You will do suction first in. Your options are option A, mouth, option B, nose, option C, where the secretion is more, या option D, where the secretion is less. The correct answer is answer number A, that is mouth. Explanation is, always do first suction in the mouth, then the nose, because if you do the suction in the nose, first it will stimulate pharynx and cause aspiration. So to avoid this, always do the suction first in the mouth. Question number 7 is, if a narrow cuff is used for measuring BP, then what will be the outcome? Your options are option A, actual reading will be obtained. Option B, falsely high reading will be obtained. Option C, falsely low reading will be obtained. Or option D, that is BP can't measure. Correct option is option B, that is falsely high reading will be obtained. Explanation is use of narrow cuff leads to falsely high reading and use of large cuff will cause false low reading. The BP cuff size is breadth of the cuff, that should be 40% of the circumference, and length of the cuff will be 80% of the circumference. Question number 8 is thrombocytopenia is. Your options are option A, increase in platelet count, option B, decrease in platelet count, option C, increase amount of blood clotting factor, or option D, that is decrease amount of blood clotting factor. Correct answer is answer number B, that is decrease in platelet count. Explanation of this question is it means decrease in platelet count. Leukopenia means decrease in WBC count. Next question is urine bile can be tested through. Your options are option A, that is Hayes test, option B, Benedict test, option C, Felling's test, या option D, that is cold test. The correct option of this question is option A, that is Hayes test. Explanation of this question is Hayes test is used to detect urine bile presence. Benedict and Felling test is used to detect urine sugar, and cold and hot test are used to detect urine albumin. Next question or the last question of this video is core body temperature can be obtained from. Your options are option A, from rectum, option B, tympanic membrane, option C, right atrium, or option D, that is all of the above. Right option is option number D, that is all of the above. Explanation of this question is all of the above mentioned sites will provide information regarding core body temperature. Tympanic membrane is supplied by same blood vessel which is supplying hypothalamus. So, it will give information related to core body. Thank you for watching this entire video. If you like it, hit the like button, share and subscribe to our YouTube channel. Thank you.